Hi everyone, I'm Dr. Karishma Kagodu and today we are going to discuss to you a few myths and facts about the blepharoplasty surgery. Blepharoplasty commonly is also known as the eyelid surgery. This blepharoplasty or the eyelid surgery is commonly performed to bring about cosmetic changes around your eyes. Now remember, the eyes is like the most aesthetic feature of most of our faces, and most of us like to have brighter and fresher looking eyes. One of the most common and early and first signs of aging is usually seen around the eyes. Now these common signs of aging around the eyes are usually seen in the form of excess skin around the eyes. It could be the upper eyelid or the lower eyelid. It could be development of certain wrinkles at the corner of your eyes, and these are known as the crow's feet. Sometimes you can see bulging of fat in the lower eyelid or sometimes in the upper eyelid. There could also be puffiness around the eyes. There could be certain bulges happening. There could be a feeling of heaviness on the eyelids. So most of the changes which happen around the eyes are one of the first signs of aging that we usually see. Coming to the first myth about blepharoplasty surgery, that the scars will be very visible. Let me tell you, the scars are almost invisible. When we do make the incisions for these eyelid surgeries, we make sure that we make the cuts along the natural skin creases that already exist in a male or a female. Now coming to the upper eyelid, the kind of incision we made is along the deep eyelid crease. Now when you close your eyes, you will notice that there is an eyelid crease which already exists. When I make an upper eyelid blepharoplasty cut, I make the cut and identify this eyelid crease and make it along that line, so that later on it is least visible and it almost looks like it is your existing eyelid crease. And the stitches that are put to close this incision are also extremely fine, are within the skin, and they are removed by the 5th day. When you talk about the lower eyelid, there are two types of procedures. One, it is transconjunctival, or one which is transcutaneous. When we say transcutaneous, it is from the outside of the skin, just below the eyelashes. There is a natural skin crease which takes place, and that is called the gray line. And along this gray line, which is about 1 to 2 millimeter below the eyelash line, that is where we make your incision. So the eyelashes generally cover that incision line, and we put very 2 to 3 fine stitches when we finish the surgery. The other approach, which is the transconjunctival approach, is where we make the incision from within the eyelid. That is, when we open the eyelid, you will see within the eyelash internally there is a fine incision made. So in both the cases, the incisions are hidden and they're usually not visible after the procedure. So the fact is that any of the eyelid surgeries, if planned well, planned precisely, the later on scars are highly invisible and can be easily camouflaged with even makeup. The myth number 2 is that eyelid surgery can affect your vision and affect your eyes. That is absolutely not true. Let me tell you, eyelid surgery is only dealing with the skin and the soft tissues which is outside the eyes, and we are not going into the internal side of the eyes. When we make the procedure, we usually deal with the skin of the upper eyelid, the skin of the lower eyelid, and the fat compartments which are present around the eyes. And the eye per se is very internal and very deep. So when we approach the skin, remove the excess skin or fat in these eyelids, we are only dealing with the external skin and fat. We are not going to affect your vision. We are not going to affect the inside your eyes, and no cut is made inside your eyes. In fact, in most of these procedures, you are awake. It is done doing local anesthesia, and you will be absolutely visualizing what is happening around you. For a few patients who are uncomfortable, we give them general anesthesia, and even then there is no need for us to go into the internal side of the eye. So remember, the eyelid surgery does not affect your vision. It is not an internal eye surgery. It is an only external surgery dealing with the skin and fat tissues around your eyes. Myth number 3 is that doing a lower eyelid surgery will take away all my wrinkles. Let me tell you that wrinkles happen due to the contraction of muscles around the eyes. And as we start aging, these muscles get overactive. And as these muscles get overactive, when we animate, we see certain wrinkles developing. These are known as the crow's feet. So these crow's feet can only be treated by Botox, and that is a fact. Then eyelid surgery is not going to treat the wrinkles around the eyes. Remember, there are two kinds of wrinkles, dynamic and static. What is dynamic wrinkles? It is when we are animating, making facial expressions, and these wrinkles only come when we are making facial expressions, and those are dynamic. And as we age and the process of aging worsens, what happens is that these wrinkles start becoming static. That is, that they exist even if we are not animating the face or making facial expressions. So to not make these wrinkles static, we need to give Botox at the early stages so that we soften these muscles and that these muscles are not hyperactive and do not lead to static wrinkles. Remember, the periorbital or the area around the eyes, the wrinkling can only be treated with Botox, that is relaxation of the muscle. Now, in case these wrinkles have become static and they have actually formed loose skin and creases in the lower or upper eyelid, that is when we perform a blepharoplasty or the eyelid surgery, where we can actually remove that excess wrinkly skin from the lower eyelid or from the upper eyelid. So that is when your wrinkles become very static, and it is also associated with very loose skin. So all the loose, crepey, wrinkly skin can be taken off and they can be made to create a very smooth looking upper and lower eyelid. But in the initial stages of aging, when there is just wrinkles forming on facial expression, all you need is a few units of Botox to relax that. So when you smile, these wrinkles will not be so obvious. And let's talk about myth number 4. That is, eyelid surgery can correct my droopy eyebrows. Now, these are two very different sets of things. Now, when you come with heaviness above your upper eyelid, or sometimes you feel there is a drooping of the eyelid or sagging on the corners of the eyes, and you feel that it is because of the droopy eyebrows. So it is up to us to differentiate between, is it excess skin in your upper eyelid or is it the droopy eyes? Not all the time is your droopy eyes causing your drooping of the eyes. Sometimes it is just the excess skin above the upper eyelid, and that excess skin hangs over your eyelid, hangs over your eyelashes, and that is why you feel it drooping. But at times, yes, it is the droopiness of the eyebrow. And how do we test it? We ask the person to close the eyes, we raise the eyebrows, and we ask them to close the eyes, and we see, is it excess skin or is it the drooping eyebrows? And sometimes even without doing this, you see that the eyebrows are drooping. Normally in women, the eyebrows usually extend above this particular bone, what we call the supraorbital bone. Now I'm getting a little technical, but just to tell you, in women, the eyebrows should normally extend above the edge of this bone and then go sideways, giving a little arched appearance. Whereas in men, you see that the eyebrows are more flatter and straighter, going along the ledge of this bone. So we can also differentiate whether you have droopy eyebrows just looking by the position of your eyebrows. Is it above or is it below? And yes, many times the eyebrows are very heavy and they tend to fall onto the eyelids, creating the heaviness. But in those cases, you need a brow lift. You do not need an upper eyelid blepharoplasty. And upper eyelid blepharoplasty is only done when you have upper eyelid excess skin, and that has to be differentiated from the droopy eyebrows. So sometimes a combination of an eyebrow lift with removal of excess skin on the upper eyelid is done, and this is all part of what we call a periorbital procedures. So a blepharoplasty can be combined at times with a brow lift. Well, I hope by listening to this video, you have a little bit of clarity in your mind about a blepharoplasty eyelid surgery. Trust me, there are various procedures can be done around your eyes to actually rejuvenate your eyes and make your eyes look brighter and fresher. Well, we can only say what you need when you come and consult us. So please do visit our website www.kaesthetics.in and take an appointment with me, and I will help you to help rejuvenate your eyes, and we will help to see your issues which are troubling you, help to solve them, and make sure you have brighter looking eyes.